inflammation is how our body defends itself against disruptions to its protection systems. Put like that, it seems complicated. But let's try and simplify it. If, while walking, we trip and fall, we could easily graze our knee, as children often do. This graze disrupts our body's protective surfaces, or rather the skin. This means that bacteria can enter, and therefore we need to defend and cover this area to stop this happening. This is the inflammation mechanism, calling protective white blood cells to the area to allow it to rest, and therefore protecting it against further damage. Acute and chronic inflammation are the two known types of inflammation. Acute inflammation is caused by a harmful event, for example, the aforementioned fall or grazed knee. Chronic inflammation, on the other hand, continues over time. This is because whatever caused the inflammation has not been resolved, therefore causing a vicious circle. Another example is arthrosis, damaging the synovial cover of the joint. It causes the two interlocking parts of the joint itself to rub, therefore causing in turn chronic inflammation, one of the distinguishing elements of this pathology. At certain times, this chronic inflammation becomes acute, blocking our joints so that our defence system can immediately get to work and avoid the damage worsening. Inflammation and pain require the use of appropriate anti-inflammatory medicines, but we should turn to drugs only after we have taken all steps to prevent the illness from becoming acute again. Using the example of arthrosis and backache. If the painful area is mistreated, for example, if our sitting position is wrong or if our posture is not correct, the inflammation can become acute once more. Therefore, prevention is one of the primary elements if we don't want to have to intervene with treatment. Faced with arthrosis of the spine, of the knee, of the shoulder, secondary measures, such as those activities that avoid inflammation becoming acute again, mean prevention. This means that thermal bath treatments in suitable spas, especially in thermal water that has anti-inflammatory characteristics, become an indispensable part of therapy and prevent the illness that caused the inflammation from progressing, therefore stopping the pain from coming back over and over. Moreover, we should bear in mind that thermal treatments maintain their effectiveness even after the spa break itself. Therefore, if we treat ourselves to a spa break, for example at Abano and Montegrotto, the longer we stay, the longer that feeling of well-being will last when we come home. This means we can reduce our drug intake, meaning a reduction in substances that are potentially harmful to our bodies. Medicines have their place, of course, but they are also potentially harmful.